You're listening to Beyond Wellness Radio, bringing you the cutting edge in health, biohacking, and sports performance. Stay up to date and listen anywhere and anytime on your computer, tablet, or smartphone by subscribing on iTunes. Catch your host, Dr. Justin Marchegiani, as he answers your burning health questions as well as interviews from world-renowned guest experts. For more Beyond Wellness Radio, go to beyondwellnessradio.com.
Hey there, it's Dr. Justin Marchegiani. Welcome to Beyond Wellness Radio. Feel free and head over to beyondwellnessradio.com where you can access our full podcast transcriptions. While you're there, you can also sign up for our thyroid and female hormone video series. This series goes into the root cause of why your hormones are out of balance. While you're there, you can also schedule a functional medicine consult with Dr. Justin, myself, where we'll dig deeper into the root cause of your health challenges. Feel free and think of sharing this podcast with at least one person. This podcast grows by people sharing it. Sharing is caring. If you can think of one person that can benefit from this information, please feel free and share it. If you're enjoying the podcast, make sure you subscribe on iTunes. You can also click below the video or podcast where you'll see the iTunes review button and leave us a review. You can also sign up for the newsletter at beyondwellnessradio.com where you'll get updates before anyone else. Thank you so much and enjoy the show. Hey there, it's Dr. Justin. Evan, how you doing today, man? It's almost Christmas, December 23rd here. Really excited for the holidays. How you doing?
I'm as excited as you are.
Great. So the question is, have you been a good boy this year?
I'm on the good list.
Good. Awesome.
What about you? Are you on the nice or the naughty list?
Oh, of course I'm on the nice list. Now the question is, are you gonna leave some paleo cookies out for Santa, or are you gonna leave some glutinous cookies out for him?
We actually did buy some organic Annie's cookie for a Christmas party. I will probably not be partaking in them, even though it's organic, which is great. They're still wheat, so I will be avoiding the wheat. I'll probably buy a miracle tart for myself for Christmas since I'm part Santa.
Yes, exactly. That's the Hail Mary tarts, right?
Yes, those are so good. There's only one place in the whole city you can get them here, and so that's where I go to get them.
Do you guys have a Whole Foods down there in Louisville?
Yeah, we got Whole Foods. They don't stock them there, though. They stock them at this little local place called Rainbow Blossom. They have random things like Epic. They have Epic products. They have their pork rinds, and that's the only place you can get them. And They're really darn good.
Wow, very cool.
You know what I'm talking about? Epic?
Yeah. Have
you seen
bars,
them?
You mean? The Epic bars?
No, yeah, but they have pork rinds now. Have you seen them?
Oh, I have seen them. I had a patient that just got some recently.
Yeah, the pastured pork rinds. They're really good.
Gonna have to get them for sure. Love pork rinds.
High quality.
Love it. Well, we talked pre-show that we were going to chat a little bit about blood pressure. We really haven't gone into that so much.
Yeah, I mean, this is common. Just some statistics at a glance. You got 70 million Americans and 1 billion people worldwide with high blood pressure. And if it's left untreated, you run into many, many, many issues. The biggest one that people probably know of is a stroke. And one time, probably 25, 30 years ago, my grandmother had high blood pressure so high that she felt a shooting pain in her brain. So she went to the emergency room. She had my grandfather take her in, and her blood pressure was over 220 by maybe 150, 220 over 150, something like that. Just insanely high. That's so high that the nurse freaked out and immediately took action to get the blood pressure down. So this is not always the way that people find out they have high blood pressure issues. This could be going on behind the scenes for decades, but there are some simple strategies that we can talk about that can help to reduce the risk of high blood pressure. It goes up naturally with age, right? But that still should not be over 200. That's just mind-blowing.
Oh, absolutely. So when you look at blood pressure medications, for the most part, that's a chronic type of ailment. It tends to happen over a long period of time. And it's, for the most part, it's something that's chronic and that the blood pressure medications aren't going to get to the root underlying cause. Now, if your blood pressure is very high, you're upwards of 160, that's the systolic number. That's the pressure that your heart creates in the blood vessels when it contracts. And the bottom number, that's called the diastolic number. think D for down, it's the bottom number. And that's kind of where the pressure is in your artery/heart when your heart's kind of relaxing. So you pump the lub dub, that's the heart contracting, and where it's pressing down, that's the top number, systolic, and then where it's relaxing, that's the bottom number, the diastolic. So when you get above 160 with the systolic, that can kind of be what I call the danger zone. So if you are at that level, and let's say you haven't quite made the diet and lifestyle changes, I do think being on a medication at higher levels until you get to the root cause is better, because you want to avoid a stroke or some type of heart attack, right? So we want to make sure that if it's high and you're not doing anything about it, getting that blood pressure down is better. But in the long run, we don't want that to be the only answer. We want to look at getting to the root cause, and we'll kind of go over some of the root causes here in just a bit.
Great point. So just to be clear, if someone's listening and they have high blood pressure, but they're scared or they do not like conventional medicine, you would still advise that person to go get on the drug, even if it is short term, because you're safer on a drug with side effects that lowers blood pressure than having high blood pressure and doing nothing.
Exactly. And we're talking upwards of above 160. And let's say you already have a lot of unhealthy habits going on, poor exercise, sugar, inflammation, all that, and you don't quite know where to go yet. Again, I just would hate to see someone, I'm a little more conservative, I hate to see someone go and have a cardiovascular incident that could have been prevented with some blood pressure medication in the short term. But in the end, right, we want to get on board with a functional medicine coach/doctor that can get to the root issues, because the nice thing about blood pressure, it's easy to monitor. You get one of these $30 Omron blood pressure cuffs, the self ones, on Amazon, and you can monitor it multiple times a day. And then you can see the number go down, and guess what? You just call up your doctor. Hey, doc, I'm doing some natural things to help lower my blood pressure. My blood pressure's dropping naturally. I like to taper off the medication. And most medical doctors, if you're being responsible and monitoring it and you're telling them you're doing things, they typically have no problem with that if you're showing that you're responsible by keeping track of it.
Yep, well said.
Yeah. So off the bat, anything you want to comment on that?
Well, so with blood pressure, there's tons of things that can cause it. I would say we should probably dispel the myth of the salt high blood pressure. I mean, that's kind of part of it's true if we're talking about the garbage salt, right? The iodized salt, the sodium chloride plus iodide. But with like a good pink salt or a good Himalayan sea salt, there's so many different options with black salts. There's volcanic salts. The sodium is not going to be the problem there. It's the inflammation combined with a low-quality salt that could be the problem, right?
Yeah, they've done studies. I think it's in the Journal of the American Medical Association where, like, salt, even I don't think they differentiated the quality of salt. Probably your regular table salt that's not so nice. I think it increased like maybe 2 millimeters of mercury, right? 2 or 3. That's like the top number. That's like going from 120 to 122.
Why did that become such a popular, widespread myth, do you think?
It's a great question. There's a lot of things in conventional medicine that are that way. I mean, you can look at grains, you can look at sugar, you can look at trans fat. I mean, you can look at cigarette smoking, you can look at so many different things of how they kind of got that way. But for the most part, the only motivation to avoid salt is if you already have severe kidney damage. That'd be the only reason why you'd want to decrease salt consumption, is because you have active kidney issues right now. But if you didn't have that, getting high-quality minerals on board will be helpful. And again, if your blood pressure is excessively low, salt will help bring your blood pressure up kind of in a modulatory way, but it won't make it go excessively high. You won't have high blood pressure because you have more sea salt intake. You will have higher blood pressure, but higher and high are two different things. Higher meaning a couple millimeters of mercury bump. That's what we're looking at. Except
Makes sense.
If it's low, it'll bring it up much higher because let's say that your adrenals are really key at holding on to minerals. And if you're decreasing your mineral retention because the aldosterone that your adrenals make is low because of the adrenal dysfunction that's happening, you will pee out more minerals. And that's important for regulating blood pressure. And that's also important for their sodium potassium pumps. So if we don't have enough high quality sodium, those sodium potassium pumps that creates the gradient and how things go in and out of the cell. And if we don't have adequate sodium on board, that can definitely be a stressor for the body.
Yeah, makes sense. And you and I hear this all the time with people with adrenal problems. If you stand up quickly, you may get lightheaded or woozy. You're not regulating your blood pressure. You may not have high blood pressure. You could actually have low blood pressure in some of those cases. But either way, your body's ability to regulate blood pressure does decrease if there is adrenal stress, which definitely there's going to be adrenal stress if there's infections and inflammation and all the things that you've already mentioned. Maybe other things like insulin resistance. How do you know if you're insulin resistant? Well, if you look into, there's calculators and all of that to look at waist to hip ratio and all of that. But if you look into the mirror and you see that you're overweight, it's likely that you have some level of insulin or possibly leptin resistance problems, which can then cause blood pressure to go high.
Absolutely. So when we look at blood pressure, one of the biggest things that will throw your minerals off and cause a higher than normal blood pressure is increase fructose consumption, i.e. sugar, and just increase elevations of insulin. Insulin will cause a retention of sodium. That's why one of the first things you notice, you cut out sugar for 2 or 3 days, you lose like 3 or 4 pounds of weight, maybe even more. Now, you're not losing 3 or 4 pounds of fat. You're losing 3 or 4 pounds of fluid because as the sugar goes down, right, 1 molecule of sugar holds on to I think 3 or 4 molecules of water, something like that. So as the sugar goes down, so does the sodium and so does the water. So what happens is you flush out a lot of fluid when you cut down the carbohydrates and cut down the sugar. And with fructose, high amounts of fructose inhibits this enzyme called endothelial synthase. Endothelial synthase is a nitric oxide-based enzyme that's really important for vasodilating. And dilation means opening up those blood vessels. So if we decrease the enzyme that opens up those blood vessels, it's like clamping down on that hole. It's like going out in your garden, taking the hose that's putting out water and putting your thumb over the edge of it to make that stream go stronger and stronger.
That's a trip. Now let me stack on another idea here. If there's adrenal stress, someone's also going to be dumping a lot of magnesium, which you need that to help relax the blood vessels. So you're compounding the issue. And if you are adding the fructose or the high fructose corn syrup or sodas in there, that's going to cause blood sugar issues, which is going to create a bigger crisis. And the adrenals are going to have to be more stressed. If they're not already, they'll be more stressed because they're having to kick in as the backup generators, because then the pancreas and the liver are not being able to keep up. So the whole cascade really kind of falls apart at sugar, it sounds like.
Exactly. So we have a couple of different mechanisms. Let's break them down. So we have just the general sugar kind of mechanism. It's your sucrose, fructose, kind of glucose thing that's increasing insulin, and that's going to hold on to more fluid and more sodium, and that will increase blood pressure via that way. We have the fructose mechanism that will increase or decrease the endothelial synthase enzyme, which will decrease the vasodilation, i.e. cause constriction of the blood vessels. And we also have the plasminogen activator inhibitor mechanism. So the higher amounts of insulin we have, our plasminogen activator, what that does is it decreases clots, i.e. it increases fibrinolysis. So lysis means to cut, fibrin means like a clot. So it's breaking down blood clots. So imagine little occlusions from cells sticking together, fibrin. It's going to decrease those clots and allow smoother flow in the plumbing in the cardiovascular system. So if we decrease the clots, that means the plumbing flows smoother, and that means we're going to have less pressure to have to push through those clots. So we have the plasminogen activator inhibitor 2 mechanism that also gets strained with higher levels of insulin.
Makes sense. Should we talk about nutrition now?
Absolutely.
So omega-3 deficiency is huge. I mean, if you look at hunter-gatherers or if you even just look at Inuit studies, you'll see that the average Inuit was consuming anywhere, depending on what you look at, but on the low end, 10 or 15 grams, sometimes 20 grams of omega-3s per day. And we're lucky if we get someone to take a 1 gram or maybe 2 gram supplement of omega-3s. So there's a huge, huge deficiency. And when you look at research linking omega-3s to blood pressure problems, what you'll find is the people who have the lowest blood pressure readings have the highest blood levels or serum levels of omega-3s. This is a huge find, and this is why I'm very, very passionate about getting people to supplement with some type of omega-3. We're going to assume that most people are not eating enough wild-caught fish. And also then you run into the issue of the methyl mercury in certain bigger fish like tuna. So for me, I'm more pushing people towards a supplement because I know a lot of people don't want to cook fish multiple times a week anyway. So you can look at like a fish oil or a krill oil. But at the end of the day, Could you still get some fish into your diet? For sure. A cod or a wild-caught salmon would be good, but your, what is it called, star-kissed tuna that's probably sitting in genetically modified soybean oil, you want to stay away from that.
Absolutely. And fish oil also is a natural blood thinner. It keeps the cells from sticking together. So it's kind of a natural thinner, kind of like a Coumadin or a warfarin, but without the side effects. So it does thin out the blood a bit for sure.
Great point. Yeah, and that's why we got to tell people if they're going to get surgery, you would think, oh man, supplements are fine. That is one case where we would say, hey, look, why don't you stop taking your fish oil for now if you're going to get surgery, because we don't want your blood too thin. So it is very, very effective for that.
Absolutely. So we talked about vitamin D. There's also other natural blood thinners like ginkgo, which help increase oxygenation by increasing blood flow. Even things like systemic-based enzymes taken on an empty stomach, especially serrapeptidase. So if you have various clotting or you have occlusions in the coronary arteries, taking some of these enzymes on an empty stomach, they're going to be enterically coated, so they're not going to be used for digestion. They won't get exposed and degraded by stomach acid. Ideally, they'll make its way into the bloodstream where these guys can hit areas of plaque or occlusion and break up any fibrin or scar tissues that may be hanging out in there.
Here's another, you brought up vitamin D. Here's a good hack, and obviously it may take money if you're somewhere closer to the poles and it's wintertime. You're not going to have as much sunlight, but there's definitely some research that shows that if you expose your skin to sunlight, that it's going to increase the level of nitric oxide, which is then going to naturally help you to dilate your blood vessels and then therefore reduce your blood pressure. So you could be taking a fish oil supplement. You could be going to the beach and getting some sunshine. And then what about stress? We should probably mention stress too, because a lot of this is, we've already talked about stress, right? Nutritional stress, mineral stress, but emotional stress too. If that goes unaddressed and people are harboring anger and negative emotions, that's not good. That's definitely not helping your blood pressure, put it that way.
Well, all of that will basically increase cortisol and adrenaline, which does have a vasoconstricting. It'll put that thumb over the water hose a little bit tighter and increase that flow because of the stress hormones. So stress emotionally knocks over a domino cascade of adrenaline and cortisol, which does have a big impact on the vascular system.
Which would be good if you and I were running from a bear, right?
Yeah, it totally makes sense, right? Because we got to get blood flow to those extremities, the toes, the fingers, the arms, the legs, so we can run and fight and flee. But if we're just sitting in our desk or driving to work and we're just boiling and we don't need that type of blood flow, you can see the stress on the vascular system that is caused by that type of hormonal cascade.
Yeah, so I mean, this is another example where the ancient wiring system really does try to benefit us, but when it's chronic acute stress, which sounds like an oxymoron, but you're dealing with acute stressors like a cell phone notification, ding, and that goes off all day. That's a chronic acute stressor. Your body doesn't know the difference. So I encourage people, if you haven't, get rid of your notifications. I promise the world will not fall apart if you have your phone on silent or even airplane mode most of the time. And then you can get back to life on your terms. Because what I find with people dealing with emotional stress and hypertension is that many people feel like there's never enough time in the day. They're always playing catch up. And I found personally, if I get up a little bit earlier, I feel more in control of my schedule. You and I are very, very, very passionate about calendar software. So we love our calendars and couldn't live without them.
Yep.
So that's another helpful thing. But for me, it's also focusing on the most important things in the morning. You gave me some really good advice when you talked about kind of the morning visualization and all of that. I try to do some type of morning meditation visualization exercise. That helps to increase the amount of control. And at the end of the day, the goal is just to reduce your perceived stress. Justin and I can't wave a wand and say, okay, look, your stress is gone. But if we can fix or improve the way that you respond to what you have on your plate, at the end of the day, you're going to be much healthier. You're not going to be releasing cortisol all day. Hopefully, you're going to have less food cravings. You're going to be less dependent on glucose because you're going to be burning ketones and fat. And you're going to be in a much better place mentally, physically, cognitively, blood sugar-wise, everything.
100%. And just piggybacking on what you said, just a little bit of sunlight makes a big difference. They've done some studies, and again, a lot of this is correlation, not causation. But there are some potential mechanisms there, like with the nitric oxide and potentially with the kidney, and how vitamin D can really help blood pressure. One study talked about a 10 nanogram per milliliter increase. So, if your vitamin D is 30, that's like taking it from 30 to 40. And someone whose vitamin D levels are lower can have a 12% lowering of their blood pressure. And also people who had the highest vitamin D levels had a 30% lower risk of developing hypertension. Again, not causation, but correlation. But there are some hypothetical mechanisms that we just mentioned that could be at play. So a good rule of thumb here, especially in the winter months, get your 25 hydroxy vitamin D looked at. And if you haven't gotten it tested yet, or you don't have the ability to test it right now, a good rule of thumb is 25 per every 25 pounds of body weight, you have 1,000 IUs of vitamin D is fine. So I'm a little over 200 pounds, so I would do about 8,000 IUs of vitamin D, maybe round up to 10. Someone who's half that, obviously 4,000 is a pretty good starting point if you're just trying to figure out, hey, how can I take this vitamin D to lower my blood pressure?
Yeah, some people worry a lot about the vitamin K because we've talked before about the whole traffic cop analogy of vitamin K helping to direct and keep calcium where it belongs and not into your arteries and things like that. Do you worry much about vitamin K1, K2 supplementation, or are you just focusing on getting plenty of good butter?
If we're going vitamin D on a high, if we're using vitamin D and we're going with it for a long period of time, we'll make sure there's a couple hundred micrograms of the MK2 in there.
Yeah.
I think it's MK4 and MK7.
Yep.
So I have to look at my bottle over here. But the vitamin K2, the X factor, the activator, that's what we'll use, and that will significantly help keep the calcium where it needs to be in the bones. And also just getting high-quality grass-fed butter and essential fatty acids, a little bit of liver, all that stuff's going to be phenomenal for vitamin K.
Excellent. Yeah, I wanted to get back to more lifestyle things. We talked about vitamin D. We talked about omega-3s. Exercise is a good one for sure. I mean, the basic part of it is just that you're becoming more insulin sensitive. I mean, if you think about how hungry your appetite is when you get done with a good high intensity workout, oh my gosh, you can just feel amazing. And if I do a protein shake after an intense workout, I feel like it's going straight to my bicep. I love that feeling. But
Absolutely.
Now, if there's super high blood pressure, would we want to tell people, look, start with just walking? We probably don't want to put somebody on a high-intensity interval training if your blood pressure is already 150, 160. You might not be able to handle it. You might get dizzy and more stressed out than we want you to be.
Exactly. So you have, the mechanism you just mentioned by having the insulin receptors be more sensitive. That means your pancreas has to produce less insulin to get the sugar into your cell so it can be burnt up, number one. You're putting less sugar into your body, so you're using more ketones for fuel. So we're being more fat or keto adapted at that time. And then also the heart just gets stronger. As the heart gets stronger, it needs less force to pump. It has a higher stroke volume, so it can push out more blood per pump. And then obviously we'll have an effect of decreasing the blood pressure. And then also growth hormone and or just exercise will increase nitric oxide. And that will have an effect of vasodilating and opening things up too.
Yep, that is so cool. How about what about indoor air pollution? The EPA talks about 10 or 100 times more toxic exposures inside your home than outside. So air purification could be a good idea because if you're breathing in these different toxins, that's also an invisible stressor that's going to be elevating that whole nervous system, sympathetic fight or flight response, which we really don't need to press that button anymore.
Exactly. So anytime you put a stressor on your body, whether it's physical, chemical, or emotional, and this kind of fits into the chemical realm, i.e. toxin realm, that can be a stressor on the body, and your adrenals and your fight or flight system may respond. It may put you into a sympathetic type of stress response. And again, we already know what happens with that cortisol increase. That's going to create constriction. Why? Because the stress response pushes blood flow to the extremities, right?
It's for survival over, I don't know what the other side of the coin would be, but your body goes for survival any day.
Yeah, exactly. Surviving over thriving. The problem is thriving only happens after the survival mechanism is turned off, but most people are constantly living with that survival mechanism turned on and activated.
So now this can get a little bit complicated, so I know this may be tough for us to cover this, but let's say we have someone that is already on a blood pressure medication like a lisinopril, and we're wanting them to go the natural route, or they have intentions to go the natural route. How does that work? Do we bring the doctor on board and we have to say, look, I'm working with a functional medicine practitioner. We want to start using some natural things like hawthorn or other blood pressure modulating herbs. Can you help me to lower my medication? How should that relationship happen between the prescribing doc and then someone like us trying to help to switch them to something natural or just get them off any type of meds completely?
So what I typically tell patients, I say is, well, are you interested in getting off your blood pressure medications? Do you want to get off them? And almost anyone that's seeing someone like us, they definitely want to get off them. Again,
Right.
the biggest problem with a lot of the blood pressure medications is they actually perpetuate the need for more blood pressure medications. So what I mean is they actually create nutrient deficiencies. Things like potassium, which are really important for blood pressure, magnesium, which is a natural beta blocker, these little receptor sites in the heart that the nervous system activates, and it creates more excitability in the heart, and that can cause the heart to have to pump harder, and that can increase the blood pressure in the arteries. So magnesium is a natural beta blocker, really important for relaxation. People that take it, one of the first things they notice is they start to relax and wind down. That's why Epsom salt baths are so popular for people that are stressed. So magnesium, potassium, calcium, various B vitamins. So all these nutrients become more deficient in these types of medications. These medications are known to create these nutrient deficiencies. So like I mentioned before, acutely, if you're not in good place, you want to be on one of these medications until you can get your lifestyle and everything in order, and you find a good nutritionist and or functional medicine doctor to work with. That's when you can start to move forward. And the nice thing is you just monitor it. You can tell your doctor, hey, we're going to be doing some things to help lower it naturally. A lot of times they think there's nothing you can do. I mean, they may be keen on the whole diet and lifestyle thing. They may think that you can't get down to the point where you are off the medications, but a lot of times they'll entertain the idea, hey, let's monitor it, let's see where you're at, and you can go from there. The biggest, though, misconception you got to be careful of, if you're only testing your blood pressure during the day when you're at the doctor's office, we call it the white coat syndrome, just being around the doctor in the office and all the, hey, am I going to get a shot today or a needle or give blood, whatever. So it's a lot of stress about getting poked and prodded when you go to the doctor's office. That can increase your blood pressure as well. So I tell my patients, first thing you get up in the morning, you're still horizontal, you're lying down, take your blood pressure there. Take it at random intervals throughout the day and just kind of make some notations of how your blood pressure ranges. It may be 20 or 30 millimeters of mercury higher when you're more active, but when you're more relaxed, it may be 20 or 30 lower. And
I had my grandfather.
Yeah.
Sorry, I didn't mean to interrupt. I had my grandfather do that because he went to his doctor, which he doesn't like his doctor anyway. And I tell him, look, you can get a new doctor. He feels so stuck. I don't know. It's just that mindset. Anyhow, 40-point difference from morning when he first got up, took his blood pressure.
Yep.
Compared to at the doctor's office. I mean, we're talking a difference of 120 to 160. I mean, that's insane. 40 points. So here you go. And it's not like the doctor is going to monitor you and say, hey, let me check your blood pressure again next week. If they see that high once, they're going to put you on the drug.
That's it.
And write that prescription that quick.
Exactly. And the insurance-based model for visits with your conventional MD, there's just not time to talk about diet, nor are they even educated about it. There's virtually zero nutritional education, and if there is any, it's based on a pathological level, right? Vitamin C causes scurvy, B1 deficiency causes beriberi, or it's the food pyramid, eat your 10 to 11 servings of grains a day. Let's not talk about the GMOs or the carcinogenic pesticides sprayed on the food daily.
Oh
So
my
you don't
gosh,
get
I
the
know.
best perspective.
I was watching a video by Eric Berg. You know Dr. Berg?
Yep.
Watching a video of him talking about glyphosate, which I already knew most of it, but it's just mind-blowing that now research is starting to look at how small of glyphosate exposure it really takes to disrupt this whole hormonal health cascade. I mean, we're talking parts per billion or parts per trillion in some cases. I mean, here you are thinking, oh, the 80-20 rule, 80 organic, 20 not. I want to be as close to 100 as I possibly can.
Exactly. 100%. And again, Glyphosate, aka Roundup, right? That's the major pesticide sprayed on a lot of these Roundup resistant crops. Basically allows them to not have to do any weeding at all because it kills everything except the plant, i.e., it kills the weed. And it's a chelator, so it pulls away minerals. So guess what? It's pulling away a lot of good minerals. Some of the ones I mentioned that are really important for healthy vascular health and controlling blood pressure.
Yep. Wow. That's a trip. And you combine that with 24/7 technology, fight or flight mode's going.
Exactly. So obviously getting the adrenals under control, getting the diet under control, getting your glycemic load under control, meaning keeping the carbohydrates within range for you. If you're overweight, getting them close to 50 and getting more to a ketogenic approach starting out is going to be a great starting point. And then getting some of the extra nutrients back in, like magnesium, zinc, potassium, folate, B6. These are common nutrients that are deficient in people taking blood pressure medications, right? We talked about the nutrient deficiencies caused by these medications, and then also adding things like hawthorn or AKA foxglove. I think is a medication made after these herbs too, that's conventionally
I think
used.
they're rooted from I think they come from the plant, and of course they patented and change it to where it doesn't resemble the plant anymore. But
that's it. So some medications are actually made from those types of extracts. So we kind of reviewed the diet and lifestyle things, and these drugs work a couple different ways. You mentioned the lisinopril or the hydrochlorothiazide. These are like water pills. They just cause you to pee more and lose more of the fluid. Then you have ones that affect the angiotensin converting enzyme that affects, it's in the lung area. And then you have ones that affect the receptor sites in and around the heart, whether it's the beta blockers or these adrenergic receptor blockers that affect heart contractility. So there's a couple different ones there. And again, in the end, we want to get to the root cause of why you have these blood pressure issues to begin with.
Yep, absolutely. I'm sure we could make this an hour long show, but it always is going to end. You gotta dig deeper and figure out why. We could talk all day about the lifestyle and all of that, but in some cases, people are doing everything right, or what they think is everything right, and they still have high blood pressure. So there could be some other type of infection or something deeper that is causing this sympathetic stress, and we just have to uncover it. And I don't know if I mentioned it to you. I ran a 401H and a GI map side by side on a female, about 2 weeks ago. And the GI map showed up with 7 infections, including 2 parasites, and the 401H showed up with nothing.
Wow.
Is that not crazy?
That is pretty crazy.
So I sent it over.
Was the other one the GI map?
Yeah.
Okay. So we got DNA technology on one versus the antigen-based under the microscope technology on the other.
Yep, and I have to go on symptoms because, there was a lot of symptoms. So get tested, but
yeah.
What were you going to say?
You know my method on that. If anyone has gut symptoms, we always want to cast a bigger net because we have the possibility for holes in one. So 2 tests as a minimum when we're looking at gut infections for sure.
Yeah.
And again, the nutrients that are so important for heart contractility, we're always trying to, if we go off on a tangent, everyone, we'll pull it back in and try to relate it. But the nutrient deficiencies caused by some of these infections, these nutrients like the magnesium and the B6 and the folate and all of the other minerals, potassium, magnesium, etc., zinc, are really important for heart contractility and blood pressure. So if we have holes in our intestinal tract, metaphorically, where we have a decrease in the absorption of these nutrients, that can affect our vasculature and our blood pressure for sure.
Yeah, so we're talking SIBO, other, any type of bacterial overgrowth problems, yeast problems, parasites, things that are stealing your nutrients, basically, you're referring to, where you're not getting fed yourself because you're starving from the inside out because you're feeding something else and not feeding yourself, or hydrochloric acid levels are low. Could we go as far as to say
100%?
This cascade could start by having heartburn and then getting put on PPIs, which then reduces hydrochloric acid, which then reduces absorption. So then the nutrient deficiencies cause the hypertension.
100%. And I've seen so many patients that are adrenally fatigued or have adrenal dysfunction per se, and they can't really regulate their blood sugar. They have to eat every 2 hours, and their blood pressure gets super wonky, right? Goes down below 90 sometimes. And we have to flood their body with extra minerals, enzymes, and hydrochloric acid, and eat every 2 hours just to be able to maintain everything because the glandular system is so out of whack, which, again, correlates back to blood pressure. Now, on this side of the fence, we're dealing with the lower side, which can still create just as many issues. not as quite traumatic as the high blood pressure ones with stroke and heart attack, right? Heart attack is occlusions and blockages in the heart. Stroke's obviously occlusions and blockages in the brain. So we want to do our best to avoid the high stuff and make sure we adhere to as many of these natural strategies as possible.
Yep, absolutely. Well said. So if it's high, implement the stuff that you can. Take the free information. And then if you need to work further, reach out to Justin, reach out to myself, get help, get this taken care of. This is something that is so common, but that doesn't make it normal. So many people can relate to high blood pressure. Maybe you've dealt with it or you have a family member that's dealt with it. I could think of a dozen people off the top of my head, and they just get put on the drugs. Nothing ever changes with diet and lifestyle. They continue to suffer and will get more symptomatic as time goes on. So don't be in that statistic. You can get healed and you can reverse this without too much hassle in a relative amount of time.
Exactly. So if someone's tuning in now, maybe they fell asleep the last half hour. Well, shame on you. No. But here's the general gist, okay? Here's the gist. If you fell asleep and you're waking up now, diet, get it in order. Just what Evan said. Get the carbohydrates dialed in. If you're overweight, start with just vegetables and maybe add in a small amount of low fructose types of fruit. From there, optimize fat, become a fat burner. And then on top of that, look at the adrenals, look at your stress. Make sure that's dialed in because of the cortisol response. And then off top of that, look at the nutrients, magnesium, zinc, hydrochloric acid. Look at blood pressure medications, potentially
omega-3s.
Omega-3s. You can look at herbs that can help, the foxglove / hawthorn types of medications, or herbs, I should say, which are based off of medications as well. Omega-3s, blood thinning, ginkgo, systemic-based enzymes, hawthorn. These are all really good things to help kind of support and address blood pressure, and then get to the root cause, work with a functional medicine doctor that can help you put it all together, because it can be a little overwhelming if you're walking into this and you're like, shoot, where do I start? And then also a little bit of exercise, and then really look at the fructose, because how that has an effect on the endothelial synthase and the blood pressure via the contractility in the arteries.
Yep, well said. And I have heard people say that they like listening to us because it's relaxing. So you did a great job. In case I did fall asleep for the last 35 minutes, that you summed it up. So good job.
Perfect. Excellent. And again, most people that come and see me, at least, and I think it may be for you, most people are coming because of a whole bunch of other symptoms, and then blood pressure is kind of like an artifact there sitting in the background.
Agreed. Yeah, that's exactly the case. They've been through 10, 20 people. They've been going for fatigue or joint pain, but, I happen to have high blood pressure too. And it's something that gets thrown to the back burner, and I don't think it should be on the back burner.
Exactly. And most people that are just seeing their medical doctor, the medical doctor is more than happy to manage it, which we mentioned is great in acute cases, right? But long term, that's not going to be the best option because of the nutrient deficiency. So in the end, don't look at your medical doctor as the long-term person to give you the answers to fix it. They're just there to help manage it. And again, who wants to manage, diarrhea forever? You want the diarrhea fixed. Who wants to manage a headache forever? You want the headache fixed. So management's okay in the short run, but in the long run, it gets pretty frustrating, and you want to get to the root cause.
Amen. You can only put so much duct tape over that red light on your dashboard, and you just got to fix what the problem is. Why is that light on in the first place?
Exactly. Yep. Well, this is a great holiday show. Everyone's probably, I shouldn't say everyone, but a lot of people are going to be getting their carbs and their refined sugar and gluten on this holiday season. I will not be, or if I do, it's going to be in a way that is ideally grain-free and lower sugar, so I get the mouthfeel effects, i.e. the food tastes good, but I don't get all the collateral damage later.
Agreed. So what if you wanted to do like some mashed potatoes and gravy? Would you do something like that and try to get a wheat-free gravy taken care of, like a slow-cooked turkey that would have some natural gravy coming off of it, or what? How would you do it?
Some mashed potatoes. Loaded up with some good butter, heavy cream, and then for your gravy, you just throw some of the drippings from the turkey in there with some celery, and I use carrots, and I blend it up just like that, and it's just super thick. If you want to make it a little thicker, you can add a little bit of coconut flour, and that'll give you a nice thick gravy there. And if you want, don't go to the potatoes, go to the sweet potatoes that have a little bit of a lower glycemic index, i.e.
Yep.
they don't convert to sugar in your blood as fast. So that can be a good move. Or you can do the white potato. You can do 25% white potato, 75% cauliflower mash, and you mix it in, and it gives a pretty similar mouthfeel. You won't really know that much that you're not eating it, but now the glycemic load is decreased by 75%. That means less insulin.
That's excellent. Excellent. Yeah, I got my wife converted over to sweet potatoes now. She's like, wow, these are so much better than white potatoes. I'm like, I've been telling you that for 3 years.
Exactly. Anytime I'm dealing with patients, the key thing with dealing with patients when you're making diet changes, the first thing they go to in their head is like, oh crap, I got to remove these foods. That creates a stress response. So I'm like, no, we got to be solution oriented. What's the substitute? Because there's tons of substitutes. So if we get them thinking about what's the substitutes, how can I create the mouthfeel? And how can I get that taste in my mouth that I want, that I'm missing by eating the bad food? How can we get it with the good food? So like last night, I wanted a whole bunch of pasta. I'm like, oh, I really want pasta. So I got some Miracle Noodles, which are made from glucomannan, a fiber. Basically has 0 calories and 0 sugar. And I did a whole bunch of butter noodles, and I had it with some rotisserie chicken, and it was phenomenal. And I felt like I was eating pasta. But no sugar, no grains, virtually no calories, which obviously calories don't matter, but it's nice that you can eat a lot of it, and it's not going to impact your insulin levels.
That's so cool. Yeah, and I'll speak for myself and possibly you too. Put it this way. I love eating. If this way of eating was horrible, I wouldn't do it. I mean, I am not missing out on taste or pleasure from my food at all. I'm more satiated than ever before. I feel so much better. My brain works so much better. There is light at the end of the tunnel for sure.
Yeah, my favorite line is nothing tastes as good as good feels.
Say that again?
Nothing tastes as good as good feels. Meaning, it for me, it's more rewarding to feel good later than to get that short taste in the moment of some crappy inflammatory foods. Because in the end, it's great, but then I just feel crappy. I'm bloated. I'm gassy. I got brain fog. So you got to weigh in that. You got to weigh in all the deleterious side effects with that short-term thing. And a lot of times there's a risk-reward analysis you can do where you can pull out some sugar, maybe use some stevia or xylitol, or cut down the carbs, or do a different source there that's less inflammatory where you feel good. And then, honestly, if you're like, screw it, well, throw in some charcoal. Take a whole bunch of charcoal to help decrease the toxins. That's another good plan B.
Yep. I feel like we're rambling at this point. I feel like this is the talk after the first cider has set in after the main conversation.
Yes. I know. Nice little tidbit for anyone listening, though. These are all gems, I think, though.
Yeah, I agree. Well, let's wrap this thing up. Go check out Justin's site, justinhealth.com, and then check out notjustpaleo.com. You could reach out to one of us, get help, get to the root cause. Justin's got some free thyroid videos. I've got some videos on my site as well you could check out. So plenty of information. There's no shortage of clinical pearls at this point, I don't think.
Absolutely. Anyone that's everyone that's getting ready to celebrate their holidays, I wish you a Merry Christmas and a Happy Holidays. And if you're kind of on the fence here, trying to figure out when's a good time to make changes in your health because you're struggling, now's always a great time. The new year's coming up, so feel free and reach out to Evan or myself. Info's below, and we wish you a super happy and healthy new year.
Take care.
Thanks, Evan. You too.
Bye.
Bye.
Got a question for Dr. J? Go to BeyondWellnessRadio.com and click the questions button. Then tune in to hear the answer. Also, if you like the show, click below to review us on iTunes. For more Beyond Wellness Radio, go to BeyondWellnessRadio.com.